Maternity question 3. 16. Amniotomy is performed on client in labor. The nurse is examine the amniotic fluid and would expect to note which of the following if the amniotic fluid is normal. 1. Light green with no odor. 2. Thick white with no odor. 3. Clear and dark amber colored. 4. Pale colored with flecks of vernix. The correct answer is 4. Pale colored with flecks of vernix. 17. The nursing student is asked to describe the corpus of uterus. Which of the following responses is made by the student indicates an understanding of the anatomy of the uterus? 1. The corpus is the lower portion of the uterus. 2. The corpus is the upper part of the uterus. 3. The corpus is the area where the cervix meets the external os. 4. The corpus is the area where the vagina meets the uterus. The correct answer is 2. The corpus is the upper part of the uterus. 18. A nurse is providing emergency measures to a client in labor who has been diagnosed with a prolapsed cord. The mother becomes anxious and frightened and says, "The nurse, where are these people in here? Is my baby is going to be alright?" Which of the following nursing diagnosis would be most appropriate for this client at this time? 1. Fear. 2. Powerlessness. 3. Ineffective coping. 4. Fatigue. The correct answer is 1. Fear. 19. The home care nurse visiting a prenatal client who has a history of heart disease. The nurse provides instruction to the client regarding home care measures to promote healthy pregnancy and instruct the client to 1. Restrict visitors who have affect infection. 2. Avoid becoming concerned about placing stress on the heart. 3. Increase daily calories to ensure weight gain. 4. Sleep in a supine position at night. The correct answer is 1. Restrictive visitors who may have an active infection. 20. The nurse provides instruction to a malnourished client regarding iron supplementation during pregnancy. Which statement, if made by the client, would indicate an understanding of the instruction? 1. The iron is the best absorbed if taken with orange juice. 2. Meat does not provide iron and should be avoided. 3. Iron supplements will give me diarrhea. 4. My body has an all irons it need and I no need take supplements. The correct answer is 1. The iron is best absorbed if taken with orange juice. 21. The nurse has developed plan of care for a client experiencing dystocia and includes several nursing interventions and the plan of care. The nursing priorities. The plan of care select which of the following nursing intervention as the highest priority. 1. Keeping the significant other informed of the progress of the labor. 2. Providing comfort measures. 3. Monitoring the fetal heart rate. 4. Changing the client position frequently. The correct answer is 3. Monitoring the fetal heart rate. 22. A nurse in the gynecological clinic reviewing the record of pregnant woman after the first prenatal visit. The nurse notes the physician has documented that the woman has platyploid pelvis. Based on this documentation, the nurse plans care knowing this type of pelvis. 1. Is a normal female pelvis. 2. Has a flat shape. 3. Has an oval shape. 4. Has a heart shape. The correct answer is 2. Has a flat shape.